Okay, let's go ahead and introduce our speakers today. This is going to be TEFRA coverage with Rosalind Carl from Department of Human Services, and as well as Lori Kahn from the Oklahoma Healthcare Authority. So, Lori is a native Oklahoman. She attended the University of Oklahoma and has worked for over 30 years for the state of Oklahoma at various positions within Sooner Care. During that time, she has worked with providers, members, partners, agencies, and stakeholders. Lori has managed the TEFRA unit since 2013. Rosalind Carl graduated from the University of Oklahoma. She has been a social services specialist for Oklahoma Human Services for 7 years and has been a coordinator for the TEFRA program for the last 3 years. Her primary responsibility involves helping families across the state of Oklahoma with benefit eligibility and has been afforded a unique opportunity to provide resources and assistance to individuals, families that are trying to meet basic needs. She has found that when families feel empowered and supported, they are able to advocate for themselves and their families. Without further ado, ladies, we welcome you. Let's get started.
Hi, it's nice to see you today. I'm glad that you're able to join us at noon at the lunch hour. And today we want to talk a little bit about the TEFRA program that's offered across the state of Oklahoma and how you can get started if you're going to apply for this program. We'll talk a little bit about the benefits. We'll talk about the application process and more. So let's go ahead and talk about that. So what is TEFRA? So the program's been around in various states, but the actual federal law was signed into existence in 1982. So what that means is for children that have a disability, it means that even if you don't qualify for the program, that they could possibly get those benefits. Oklahoma did not implement this program until 2005. And like I said, it's across the nation in various states, and some of them have had this program for a very long time. It's also referred to in some states as the Katie Beckett waiver, and some people might recognize it as that. So what we do is we look at we have the option to look at a child instead of the parent's income. Next slide. Okay, so what we do when we first look at everything is we look at the whole household's income. And the reason we do that is because there are times when you look at a family, their household size and their income, they could possibly qualify for another Sooner Care program. However, when we look at all those other programs, and we eliminate them, we look later and we look at those and we look at that child's benefits to see if they qualify for the program. But one of the benefits we look at is we look for what kind of level of care that child would meet if they had to be institutionalized, but that doesn't mean they have to be. Next slide. One other thing that's really important for the TEFRA program is that child can be safely and appropriately cared for in the home. They may have hospitalizations, they may need things outside the home, but for the most part, they're going to be living in the home, and we want to make sure that they have the appropriate services so they can safely remain in the home. The other thing we look at is the care that they would receive in the home is not more costly than if they had to go to, let's say, a nursing facility, just for an example. Next slide. So I'm going to talk a little bit about this, but I'm going to let Rosalind Carl talk mostly about the application process. So one thing that's important to remember for TEFRA is we have to look at, is that child considered disabled by the Social Security standards? Now, we realize that there's a couple of things that go on. They have to apply at Social Security, but there's also an income standard. Social Security doesn't necessarily look at somebody if they're over a certain, they make over a certain amount of money. The other thing we look at is if this child needed services in a institution, would they end up having to stay at like an intermediate care facility for individuals with intellectual disabilities, or we just mainly call it an ICF? Could they have their care at a nursing facility, or would they need their care in the hospital for an extended period of time? And we can talk a little bit more about that in a few minutes, but I'm going to turn it over to Miss Rosalind and let her talk a little bit more in detail about the application process.
Thank you, Lori. Let's see. So in applying for the TEFRA program, you cannot apply through Sooner Care online enrollment. However, a family's best course of action or their best option would be to apply for the TEFRA program and just come straight to the source. And what we would prefer and what we've pushed hard for is those families reaching out to our TEFRA email box at tefrafax@okhca.org. So that is the quickest communication. That's where those families can get their questions answered or get that information sent to them. Families can also call our TEFRA program at the 405-522-7752. That's the program number. Or they can call 405-982-3765. That's my DHS cell phone number. And what I'll do is when the family reaches out for information or application forms, I'll send over the application package email, is what I like to refer to it as. And that email will contain application forms, information about the program, a TEFRA packet parent guide. It'll also, this guide will talk about the entire process from start to finish. It'll give tips to that family. It talks about the documents that might be requested, and it also lets them know where they need to submit their application. So the documents that we just referred to, here I've listed typical documentation needed to determine financial eligibility. So we have a new TEFRA financial application form. I know in the past we've had 27 pages, 3 different forms that the families have had to submit, and we have streamlined that process. The TEFRA program saw that need. And so we have changed the 27 pages to 7. So now families are able to not have to go through so much paperwork, and they can address things that are specific to the program. Once a family submits that new TEFRA financial application, I will schedule a phone interview with them. During that phone interview, we will discuss the application. We'll also discuss whatever supplemental documents they might have turned in as well. We will also discuss during that interview what other information is needed so that a medical and a financial determination can be made. After we are immediately done with that interview, I'll send the family a request for whatever extra information we might need to look at. I'll send that request in writing, and it will include both financial and medical documents that we need. And speaking of those medical documents and that information that is needed, there is, all families will need to provide all families will need to provide this information. This is typical documentation. There's the denial letter from the Social Security Administration for income and or excess resources. So they'll need to provide that. They will also need to provide the Physician's Assessment TEFRA 1 form. This is a form that we provide to the families. So in that initial application package email, you will find this form. The first 3 pages of that form, we will have the family complete. That page 4 of the form will have that child's MD or DO complete. It could be a specialist or a PCP, but we'll have them complete that. What would be requested typically is that detailed medical summary letter. It is also provided by the MD or DO, specialist, or PCP. And this is a form that we do not provide. The provider will write up that medical summary on their company letterhead, and the families will retrieve that and provide it to us. Also, for any children that are that are 3 and older, an IEP is something that's typically requested, and the psychological evaluation. So what they're looking for with the psychological evaluation is that full-scale IQ and age equivalency. That psychological evaluation can be performed by a state licensed or certified psychologist with the Oklahoma State Department of Education. So that's one thing that child over 3 would need. I also talked about the IEP, that individualized education plan is typically what we request. We found there are kids that have the 504 plan as their education plan, or most recently, being in the middle of a public health emergency, there are a lot of kids that are homeschooled right now. So that education plan, that home education plan, and I have a guide, not a template, but a guide if a family is new to homeschooling their children, that I could always give a resource on if they reached out to us for that. And then therapy notes is another thing that our program is adjusting to and allowing this other documentation just because of the atmosphere we're in right now. The last thing there is the out-of-pocket expense statement. What the medical team likes to look at here is the written declaration from the family, a written declaration of what your TEFRA child's out-of-pocket expenses are after primary insurance has covered its portion. Okay, so that documentation. So those children that are under the age of 3, we want them to initiate with Sooner Start. And Sooner Start will set up goals and plans for that child, and they do that in the form of an ISSP, or that individualized family service plan. That's the first big packet. It's similar to the IEP for a school-age child, but that IFSP is what they will use to go by for that child's goals. The assessment or the developmental evaluation that they use is a Battelle or a DP3, the Battelle Developmental Inventory, or most recently what Sooner Start has been using is the DP3, the Developmental Profile. So that might be the assessment that if your child is with Sooner Start that we request from you. Let's see. So there are, once after, we've requested the documentation and all of that information has been submitted to the TEFRA program, there are 3 decisions that are made. There is a financial decision made, a disability, and that medical right there would be the level of care. So that level of care decision, the medical decision comprises disability and level of care. So there's 2 decisions, there's 2 legs right there for medical eligibility. In order to be eligible for the program, you must meet medical and financial criteria to make it to the program. We found that a lot of families will meet financial and a lot of kids will meet disability. Every single family that applies for the program has a child with a disabling condition, but it's the severity of that child's disability that makes it onto the program, that level of care that child needs. So let's see. Let's see what happens next. So once all documentation is in, also, like I said earlier, a financial eligibility decision will be made. Once I've made my decision, I'll pass my results to the medical team and they will make their disability and level of care decision, or that medical decision. So once they are done with their decision, they'll pass it back to me and I'll make the final action on the case. If a family is approved or denied, a notice will go out to that family. Since these notices take some time to get there, what I will do immediately after I process that case, whether they are approved or denied, I will send an email to the family letting them know what our findings are. If a family is approved, I'll email the family notifying them of that approval for 12 months. And I'll also let them know that they will receive a welcome call from the TEFRA program. And that TEFRA individual who calls that family will let them know what that TEFRA benefit affords that child. They'll also coordinate some other information with the primary insurance and things like that. So every case, if you go through the process, you're approved, you're on the program, that case is certified for 12 months. After 12 months, there is a recertification process. So during that recertification process, I think I'm missing a slide. Yeah. So but I'll just speak on it. During that recertification process, what I'll do is I will send out information after that child has been on the program for 10 months. 10 months into their eligibility, I will send a renewal package through email, and I'll notify the family of what they need to provide so that TEFRA can determine whether or not that child can continue with the program. And we allow 60 days. We will send that renewal information to that family, to that member, 60 days prior to their renewal coming up, because we get it. We understand that families are having to depend on entities to get that information. So going to doctors and having to go to the school to grab information or a psychological evaluation. So we will send out that renewal information to give you a heads up on what you'll need to provide. I believe that is it right here. Lori, I think you're good with benefits now.
All right. Let's talk about what happens if you're approved for TEFRA. You will get access to our Sooner Care benefits. And this is a very short list. There's way more services, but this is to give you an idea of what kind of services that you will get when you have access to Sooner Care. You'll have some office visits, which include all your well child visits, hospital care, whether it's inpatient or outpatient, pharmacy, emergency, which would be ambulance services, and non-emergency transportation, which we like to call Sooner Ride. Next slide. Yeah, there we go. Okay. And that's just, like I said, a few things. I mean, there's a lot of like the therapies that a lot of families have for their kids. There's durable medical equipment such as the AFOs and wheelchairs, walkers, things like that. I do want to take a few seconds or a few minutes to talk about what is not available through Sooner Care when you go through the TEFRA door, so to speak. This is not a Medicaid waiver program. So some people ask if there's a waiting list. There isn't a waiting list for this program. Some of the other services that we don't pay for are respite care, family training, rehabilitation services, and environmental accessibility. Basically what we call architectural modifications, such as like you need a doorway widened in your house to get a wheelchair through, or grab bars put on, things like that, and supported employment. Those are services that are offered through some of our other waivers and just not available through Sooner Care. Next slide. So let's talk about other things that, little miscellaneous things. So a lot of our families have private insurance through, the parent's job. That's okay. So we talk about coordination of benefits when we have Sooner Care and we have the private insurance. Your private insurance is primary. And so when a provider files a claim for services that your child has received, they need to file with your private insurance first, whether that be, no matter which one it is, and then they file with Sooner Care secondary. So it's really, really, really important that whatever services you're getting or whoever you're seeing for a provider, ask them if they take your private insurance and Sooner Care, and make sure that the doctor takes both as well if you're going to like a group or something, because Sooner Care won't pay if the doctor's not contracted. The other thing that's really, really important is sometimes, depending on what the service is, you may have to get a prior authorization from your private insurance as well as Sooner Care. And the doctor's office, the sooner they know that your child has both, the sooner because those prior authorization requests come from the doctor's office, the provider. So it's really important to, when you go see your doctor, let them know that you have both your private insurance and Sooner Care. And I know there's some families that they just have Sooner Care and that's fine. The doctor would just need to know if you have both. Next slide. Here we go. Here's this missing slide that Rosalind was looking for earlier. I'm not sure what happened, but yeah, TEFRA cases, like I said, they last 12 months from when the case was certified, and she sends out that request about 60 days before the case is due to review. And I think she sends those out mainly through emails these days, which is great. Okay, next slide. Okay, so for more information, this is just another place we put it. We have folks that monitor this email box, all day. So it's a great way to get a hold of us. But of course, like I said, you need to talk to us, ask us questions, go for it. There's the phone number. The first one goes to the office and the second one is a cell phone. Now, something different. The worker's going to answer your questions about eligibility. So if you have questions about the medical service, like you want to know if a certain therapy is covered, or you want to know why you're getting a bill for a certain service, we want you to call our Sooner Care helpline, and that's the 800 number right there. And there's lots of great people over there that can help you or get you to the person that needs to help you if it's not the first person that you talk to. But yeah, call the Sooner Care helpline if you've got a question about services, billing questions. Is a certain service covered? Can you tell me if this doctor takes Sooner Care? Things like that. So that is, I think, everything we wanted to talk about. And if you guys have questions, we're happy to answer them. And anything else, if you have any other questions, you can always email us or give us a call as well. And we are so glad that you took this time today to listen to us and listen to the presentation.
Thank you.
I'm sorry, I came in late. I don't know if you can hear me.
We can hear you.
We can hear you.
I had a question about for him. I have a child. I have actually two. I have autism and Down syndrome. To apply for TEFRA, what are the categories that they look at to be approved? If there's certain criteria that they have to have, or how does it differ from Sooner Care?
Well, there's a few things. Normally, okay, so for Sooner Care, they look at your family size and they look at how much, your household income is, okay? If your family makes more than the Sooner Care standards, we can look at your child or your children for TEFRA, okay? And we want to look at your child and we want to look at what's going on with them. You said one of them has autism or Down syndrome. I'm not sure.
Yeah, my son has he's 7 and he has autism level 2.
Okay.
And then I have a almost 2-year-old that has Down syndrome. And she has also like low muscle tone and other health conditions, but their needs differ a lot, or diagnoses differ a lot. And upcoming, maybe our income will increase, so we still don't know if that would fall under Sooner Care. So I just wanted to see if TEPRA would be a choice that we would have to look at as far as health insurance.
It's very possible. For most families, we tell them to go ahead and apply, and Rosalind can send you the packet. That is not a problem. And then we can start the process and get we do have to see the documentation from like the doctors and, what's going on to kind of assess how severe is that, are those diagnosis if affecting your children, and then we go from there. It's very possible to that they might qualify, but until we actually see all the documentation, it's hard to know. But she can get you an application and get started on that.
Oh, that'd be great. Thank you so much.
She put the email
Yeah.
in the chat. So yeah.
Yeah, definitely email us at the TEFRA mailbox. I've put the address there in the chat box, and we will get you over some information you could read through and see if it's a good fit for your family. Okay.
And the one thing I wanted to add about the TEFRA program, families, their income changes from year to year. So I don't want people to be afraid, you know, when they think, oh, I'm making too much money, I'll be off Sooner Care. That is exactly what this program is for families to still get the medical coverage that their child needs. And, you know, there's times the private insurance just does not cover everything that your child needs. And that's what Sooner Care, that's what this program is for
Yeah.
your children to have the medical services they need to live their best life.
Yeah, absolutely.
Looking at a question.
When grandparents have guardianship of grandchildren but not adopted, do you look at income of the grandparents or the parents? Absolutely. I mean, if you have guardianship of that child and they're living in your home, absolutely. We would look at your income and your resources if you're responsible for that child. Yes.
Good question.
Could you please provide further explanation description about the 3 decisions that are made: financial, disability, and medical? Financial, let's see. Yeah, so financially, let's just say this. Ordinarily, a family could go to the Social Security Administration, apply for their child, that child be deemed disabled, and they could get some sort of medical coverage. Well, in the case of TEFRA children, their parents have excess income and or resources. So Social Security is not going to make that decision. What TEFRA will do is they will say, we will make that decision, and we're going to use Social Security standard to do it for the disability portion. And we're not going to look at that parent's income once they get that status of TEFRA. We'll actually look at the child's income and the child's resources. And then as far as meeting that level of care, like Lori stated, if they meet one of those tiers, that if their disability is of such a severity and they meet that level of care, then they can make it onto the program. If all 3 of those decisions are satisfied, if they meet that criteria, all other factors are considered.
And I
made sense.
And I'd like to add, when we're looking at the severity of what's going on with that child, we want to know, how does that diagnosis affect the child's daily life? Does it severely impact them? Like, are they not able to speak or only able to speak a few words? Maybe they need assistance with walking. Maybe they need assistance with feeding. Maybe they need a nurse to come in and help take care of them during the day. And those are just a few examples. There are so many different needs out there with a diagnosis that's affecting the child. I can't, I could speak for an hour on different examples. I'm just giving you a few, but maybe that helps clarify a little bit.
I would also like to add, financially, I have not seen a family I've not seen parents, because we do have to look at the other sooner care programs before a child can get to TEFRA, and the status is where we're considering a child's income and resources. We have to look at all other sooner care programs first. We have to look at that online enrollment sooner care program, but we also have to look at the age blind and disabled, the ABD Medicaid program. So if the parents' income and or resources are so excessive that they are not going to be able to be accepted onto either one of those programs, that's when we look at the status of TEFRA. A parent can't make too much income. They can't. Making too much income is not a negative, is what I'll say, or having too many resources is not a negative. The driver of this program is that child's severity, like Lori's been stating. So.
Good question.
Really
Are there any other questions? Sorry, Amy had to step away, so I'm stepping in for her really quick. You guys just did such a good job. Nobody has any more questions.
I might ask one. So sometimes a child, when they're younger, the discrepancy in their abilities are less than when they become school age. And so is it something that even if you're denied when they're younger, that they would want to look at as their child ages into school and in that more school age range?
Absolutely. We find this a lot with a lot of our, and Lori can attest to this, our Down syndrome children. They may not meet those deficits early on. I can name a lot of families, probably on one hand, that at some point early on they didn't meet program criteria, but later on they did meet that criteria and are on the program today. So yeah, some of those later deficits will show up, and they may not meet early on, but they can meet eligibility later.
And we always encourage a family, if they do get a denial at that time, to reapply a little bit later on when some of those deficits will really start to show themselves.
There was a question in the chat, if you guys saw it, is there a limit to how many times you can apply?
I'm aware of.
Yeah, you are free to apply for any assistance program. I believe that's I would say any policy, you're free to apply for those assistance programs. I mean, if it's regarding income, I would think maybe 30 to 60 days in between, but absolutely, you're free to apply. Yeah, get the help you need.
Anybody else have any questions? Do you guys know, I had a quick question about the stable accounts. Does that have any effect on applying for TEFRA?
The stable ABLE account, we'd like to know you have it. It will not count toward a child's eligibility resource-wise at all.
Right.
So they are good. Those accounts are designed to help those children achieve a better life. So yeah, they are good.
Anyone else? I guess if nobody else has any questions, we can end early. I hate to end early, but nobody has any questions. So thank you guys so much for providing this information for us today. We really appreciate it. We get so many questions about the program and how to apply and stuff. So we really appreciate you partnering with us to get us this today.
Absolutely. Thank you for
Just
having
contact-
us.
Yeah. And just contact us if you have any questions.
Yes, ma'am.
I'm sure we will. So thank you so much.